somebody calls me now, like Nosufela, and I'm able to answer them, then I'm answering just because I can breathe, I can talk, and I still have life in me. So which organ do you think is responsible for you to breathe? I'm talking about no other organ than the lungs. Yes. So that means today we're going to be talking about one of the most important organs in the body. Every organ in the body is important, but however, we can do without some. For example, a woman whose uterus is causing more complication than good, then the uterus can be taken away. I don't pray for that. I don't pray for that for anybody, but I'm just saying that, sometimes things happen that we don't wish for, and but can't live without this too. So this is the lungs. Look at it. And the heart is just behind it. If you're a good anatomy student, or you're just somebody that is the heart is right behind it, and that is how it happens in the real human body. Yeah, so usually the right lungs is bigger than the left lungs. Let me show it to you very well. This is the right lungs, and that's why it's bigger. This is the left lung, and that's why it is smaller. Can you see it? This is the right lung. This is how your lungs looks like. So it has 3 lobes. The right lung is bigger than the left because of the space of the heart. Usually the heart is more to the left, and that is why the left lung is smaller. It's just like I'm making space for somebody, it's just when you sit on the bus and you try to make space for that third person, then you're really squeezing yourself. So that is what happens to this left lung. It's really making space for the heart, and that is why it is a lot smaller. So the right lungs has 3 lobes. 1, so this is cut because it's a specimen and this is a 3rd lobe. The left lung has 2 lobes, 1 and 2. I hope you can see it very well. And this is the heart, graciously sitting here. The heart is usually the size of the owner's fist. This is my fist. That means this is the size of my heart. It only means that this person maybe is a little bigger than I am, because this heart seems bigger than my fist. It means the person is probably huger or huge. That's not the right English. The person is huge, taller, or maybe heftier than I am. That's why this heart looks big, considerably big. And here, this is a windpipe. This is where respiration takes place. I'm talking to you right now. I am breathing in and breathing out. This is what is responsible for the windpipe. It's usually here. If you can see very well, you should see that there is a line here. That is my windpipe. So if let's say you cut a human being open, because we do in medicine, it might be strange to you, but we do in medicine, then you're going to have the person's windpipe like this, the lungs, and then the heart. The heart is just right behind. And there are a lot of diseases that can affect these lungs. Also, there are foods that we can eat to actually improve our lung health and our heart health. Look at this. I was going to show us some lungs, and the lungs usually perfused. Perfusion means that it's enriched with blood. The heart pumps blood around the body, perfuses the whole body, and that is why you don't want anything to happen to your heart. If your lungs is bad, you're not going to be able to breathe. You're going to probably need mechanical support to breathe. If your heart is bad, you're not going to be able to perfuse the other organs. Hypertension, there are a lot of diseases that can affect the lungs and the heart. And perfusion, look at this place, is red, like so red. Now look at this place. Let me show you something. Look at this one. This one, the redness here diminished, right? It means that this place is losing perfusion. This has been away from the rightful owner for a long time, because I've had it in my baby for 3 days now. And I don't know how many days they've had it from where I got it from. So that is what happens. Then let me show you, there's an area of darkness here. Look at this area of darkness. This is what can happen to somebody who smokes. When people smoke, their lung can actually become less perfused, and from the smoke that they inhale and all that can actually darken the lung. This one is not even dark. If you see the lung of a smoker, I mean like a chronic smoker, then you will know what dark means. This dress is not dark. When you see the lung of it, you will know what dark means. Now, what are the diseases that can affect these lungs? We have what we call chronic obstructive pulmonary disease. That one is like a group of diseases that can affect the lungs. We have emphysema, we have asthma, we have pneumonia, and a whole lot of other ones. We have tuberculosis as well. Um, taking care of the lungs, try not to inhale dust, try to eat properly, try to have your lungs check up, try to have your regular checkup. And I'm going to be moving into food. I'll try to actually talk about a little of the diseases that can affect the lungs, just break them down in smaller pieces, because I really don't like to bore people with so many medical jargon. So I try to break my health education down into very tiny bits. So that's what I'm going to do now. And afterwards, we'll talk about the food that can help your lung and heart health. If you're Oluwafela is still my name, and I hope you have subscribed to to keep our lungs healthy. The first one, and most importantly, is to avoid smoking. You either avoid it or you stop smoking. You know, some people are smokers already. Yeah, you want to avoid smoking or quit smoking. Smoking is actually very bad for your lung health. Smoking can increase your chances of getting a lung cancer. You know, for cancer, the main factor causing cancer is what we don't really know. That's the candid truth. When you read a medicine book, what you see is idiopathic. Idiopathic means on loan, right? So, but what we know of is that there are risk factors. There are things that can increase your risk of getting a cancer, and one of them is smoking. Smoking can actually increase your risk for getting any kind of cancer. Actually, I think is a major risk factor for most cancers, and especially for lung cancer. So you want to stop smoking, you want to seek help, you want to get help. Another thing you need to know is that obesity is very bad for your lung health. If you are not in shape, if you are obese, I'm not saying you cannot add a little flesh, you know, look plumpy and all that, but don't be obese. You can check for your obesity or how much you added weight or how much you need to lose by checking your BMI. That's just your weight over your height square. When you do your weight over height square, there's usually a chart that you can look into. I can make a video on that later. Yeah, so obesity prevents you from breathing deeply. Your chest is not able to expand. When I breathe, my chest expands, but when I'm too obese, too big, then when I breathe, my chest finds it very hard to expand. So that's why you find some very big people, when they climb stairs, just two step, like two, they're already panting because their chest is not expanding fully. So please, you want to cut down on those sugar. You want to cut down on your weight. Very important. Another thing you need to do to increase your lung health is to exercise regularly. When you exercise, you are breathing like 10-15 times faster than normally. So your body needs more oxygen. As your body needs more oxygen, the lung is trying to really work harder. As long as trying to work harder to make sure that you're meeting the oxygen demand, because when you're doing exercise, you're exercising, your lung is trying to expand more, so it makes your lung expand more. They open up, they're able to, the gaseous exchange is faster, you get, and it tones it actually tones your lungs. It keeps them toned, it keeps them in shape. So exercising is very good, it's great, yeah. And another thing you need to look out for is to avoid dusty environment, avoid exposure to pollutants in the environment. And for your house, you can actually inhale dust even in your house. If you don't damp dust, you don't clean your chair, you don't vacuum, then if your house is dusty, you can actually, inhale those dust, and it's very, very bad for your health. So avoid places that are polluted. I know people say Nigeria is all polluted, yes, but what you can do is cover your nose up sometimes. Thank God we're now wearing masks. I think that's a good one. It's a very good one for our health. I know the masking is not what everybody likes. We don't like it. I don't like it too, that I have to cover my makeup, but so what I'm saying is that for places that are rough, dirty, you can wear your mask, because it's really very good for you. And you have to wash your hands regularly, because if you don't wash your hands regularly, there's a tendency that you pick something on the table at work, carry somebody, and then you are putting that hand in your mouth. You just want to beg for corn. Give a cut for me, or cut coconut for me. You're already polluted. You're causing more infection for yourself, because you didn't wash down. You're supposed to wash your hands with warm water and soap, so that you keep your hands clean, because they're going into your mouth. Whatever goes into your mouth can spread around the whole body if you are not careful. So I think that's about it. What I'll just talk about next is the food that you can take to actually increase your lung health. the foods to care for your heart and lungs. I'm going to start first with the heart. Beetroot is a very good one. Beetroot, garlic, ginger, and ginseng, they are very good food for your heart health. Beetroot can actually be made into swallow. You can use it to, you can make beetroot tea, you can make beetroot swallow. For you to get more information on how you can do that, just follow at fruitclinic_ng on Instagram. Let me exclude the heart so that you can see. I'm talking about the heart now. This is it. I'm sure anatomy student can relate to this, that this is what the human heart looks like here. So garlic is actually equally good for your heart. Garlic, ginger, they are so great. You can grind them, put them in your meal. You can chew them. Garlic is actually so peppery, so spicy. But when you eat it, a lot of people have testified that their blood pressure comes down, they are better able to manage their hypertension, and they feel so great overall. So garlic and ginger is something you want to increase or put more in your food. I know if you eat it too much, it smells, right? But so what you do is to take it sparingly, maybe once a week kind of thing, because I eat it and it doesn't smell, so I just do like once a week kind of thing. So it's very good for your heart. Likewise, exercising is equally so good for your heart. Yeah, then ginseng too, you can make it into tea. A lot of these things actually can be made into tea, made into swallow, just like I've told you. Just follow at fruitclinic_ng. They also have fruits you can buy. They have them already in powder form. That is very good for your heart. It's very good for your lungs. Now for the lungs, you can have onion tea. Onion tea is really good for your lungs. Just cut the onions. You can even cut it with the bulb. Boil it 5 to 7 minutes is fine. Drink the water, or blend the onions and boil, so that you're not wasting anything. So onion tea is equally, lemongrass is equally very good for your lungs, as well as there's this fruit, this leaf called miracle leaf. I think they call it aban monda or something Yoruba. I will try to get the leaf and probably insert a picture in this video, and then maybe a link or maybe a picture of I'm sure when you see the picture, you'll be able to relate better with it. So yeah, we are done for today. I hope you've learned something. I'm going to do a quick recap. This is the windpipe associated with the lungs and the heart. The lungs, we have two lungs, the right and the left lung. The right lung is bigger than the left because of the space occupied by the heart. The heart is usually more to the left. Yeah, and the right lung has 3 lobes and the left lung has 2 lobes. You may not actually need all this information, but I like to just have information. That's why I do not bring medical jargons to you. I bring you information that you can relate to it. When the doctor is telling you that something happened to somebody's lung, you can relate to it. Yeah. Then the heart, and this is the heart. The heart is usually behind the lungs, and it is about the size of the owner's fist. That means this is the size of my heart. Yeah. So this is what the heart looks like. Yeah, so I hope to see you on another episode of Nosofela Health and Lifestyle YouTube channel, where we're going to be dissecting something else that is practical. I like to be very practical. So I'll see you guys some other time. Thank you for staying tuned. Thank you for subscribing. Ensure to like this video. Ensure to share it. And ultimately, ensure to subscribe. Yes. So perhaps somebody is wondering, how did Nosofela get this lungs and heart? Well, I had to visit the Save on Food, and they have fresh meat for you at very affordable prices. I mean, I can't remember the address. I probably put it in the description box so you can check the description box for the address. They have affordable shaki, more fresh. I mean, like freshly from the farm. Like, it's so amazing, and it's cheap. Cheap, yes. So don't forget to subscribe. I'm sure you enjoyed today's video. Let me know what you feel in the comment section. And of course, we are going to see some other time when we're back with another yumminess. And as usual, you know that on this channel, we keep it real, we keep it practical, and we keep it less bogus. Something for everybody is available on the channel. You already know. So thank you guys for always being here. Thank you so much to my returning subscribers, to everybody that's been staying true with me. God bless you, and I'll see you guys some other time. It's a bye from me now, and trust me to see you soon.